Hi, I'm Hannah Jekyll,
And I'm Ashley Hubler.
and today we're responding to the group for difficult patients. So, one thing that I want to start out with is that the group talked about how difficult patients are labeled pretty highly. So, 10 to 12% of patients are labeled difficult by most practitioners. And that is very alarming because most of us are going to be a patient at some point in our lives. So to think that the percentage is so high is very alarming.
Yeah, I agree. Peyton and Alex, they also mentioned that in psychology class, patients they're often labeled with a diagnosis. So in effect, the patient almost becomes their diagnosis. And I think this can transfer to a hospital setting as well, where you identify a patient by their diagnosis instead of you know, their individuality, their individual wants and needs, and their feelings. So I definitely agree that when you label a patient in that way, you're almost stripping them of their identity. You're not taking in consideration how they feel in a situation. So it's almost dehumanizing in a way. So I do agree with them on that for sure.
Another thing that the group identified was that one of the reasons that patients are so difficult is because there's high stresses in hospitals and clinics, and that can be for a number of reasons. Perhaps the patient just received a very difficult diagnosis. Perhaps they've been there for a couple weeks and they don't know when they're going to get out. Even doctors and nurses can be very stressed out while at work because they can work upwards of like 18-hour shifts. And if they're tense, then the patients can like feel that energy and also become tense and stressed. So it is important to identify that hospitals and clinics are very high stress environments when dealing with these difficult patients.
Yeah, I work in a hospital lab, and some of the nurses, not all of them, but definitely some of them, they can come off a bit jaded, a bit cynical. And you wonder, like, where did your bedside manner go? And it definitely rubs the wrong way if you're a patient. Um, some of these nurses, they see so many patients in a shift. It's just like a endless conveyor belt of patients. And so those patients, they almost get treated like a number, patient number one, bed number two, and so on. So that can be very stressful on their part to have to care for so many patients at once in an 18-hour time frame. That's a long shift, and it's very demanding work. They mentioned Dr. House's eye rolling picture. And I know I've been tempted to roll my eyes in plenty of situations at work when dealing with difficult coworkers or difficult patients. It's very tempting, but it's a good idea to get in the habit not to do those kinds of behaviors, because it's putting negative vibes out there. It's creating a negative work environment that can transfer to coworkers, to patients, to other providers. And so you just want to foster a better environment. And even if the patient doesn't see you rolling your eyes or muttering under your breath, I know there's a lot of patients, they can feel that negativity that you exude. So it's definitely a good idea as a mediator to refrain from doing those behaviors, as tempting as it is.
The group also mentioned that sometimes patients can become difficult due to blame shifting or become more difficult due to blame shifting. As clinicians, our gut, like whenever we see someone being difficult, we go into defense mode and we think like you're the reason that you're being difficult, you're the one that's causing this high stress situation, not me. But the patients, if they see you acting like that, they can just become more difficult and dig their heels in. So it is important to remember to avoid shifting the blame to them, like, no, it's your fault when dealing with them, because it's just going to make the situation much worse for everyone involved.
Yeah, and you should definitely avoid picking sides and maintain neutrality at all times. And Peyton and Alex mentioned that this could be the most difficult concept to master in mediation, and I totally agree. So at work, you know, my coworkers, I like them. They're awesome. They like me. We get along very well. And it is tempting to defend them in any situation because, you know, I consider they're my work friends. So my first instinct is to take their side and defend them no matter what, because they're my buds. That's not good. That's not good mediation. Count the patient's feelings in it, if not more so. Even if you are your tribe, you know, you should definitely avoid taking their side in this situation.
In order to fix problem situations with patients, it's important to identify the source of what's making them angry, because if the source of their anger is diminished or taken care of, then they have little reason to be angry anymore. So, for example, if a patient is angry because they're hungry and they feel like no one's listening to them because no one's answering their call light, answer their call light and feed them, or take care of whatever situation is bothering them. Listen to them, listen to the patient's needs, because if that gets settled, then they're not going to be a problem for you anymore and they'll be much happier, and their care will also just increase in general.
Yeah, you never treat a burden. And apology can go a long way towards establishing rapport with your patient. A lot of treat this as an admission of guilt, which is a misconception. So saying you're sorry, it's commiserating with the patient. It's not saying this is my fault, I messed up. It's just showing that you care. At the end of the day, you're there to take care of the patient, and you should care about them genuinely. And I agree with the group that it's an often overlooked practice just to say, you know, I'm sorry you're going through this, I'm sorry you feel this way. It's acknowledging the patient's struggle, it's acknowledging the hardship they're going through. And, you know, an apology, it does recognize that. And I think it goes a long way towards establishing trust in that provider-patient relationship.
And I believe that's all we had to talk about in regards to responding to this video. So I hope you all enjoyed it.